Most people think osteoporosis is something you feel early. It usually is not. That is what makes it dangerous. You can be walking around, doing normal life, feeling mostly fine, and your bones may already be getting thinner and weaker. Then one small fall, one awkward twist, even one cough in some severe cases, and suddenly there is a fracture. In clinics across the United States, this is one of the biggest reasons osteoporosis gets missed for too long. It is often called a silent disease because many people do not know they have it until a bone breaks. And this is not rare. The Bone Health and Osteoporosis Foundation and U.S. public health data show that millions of Americans have osteoporosis, and many more have low bone mass without realizing it. So what exactly is it? Osteoporosis means your bones have lost density and strength. Think of healthy bone like a strong honeycomb structure. In osteoporosis, those spaces get bigger, the structure gets weaker, and the bone becomes easier to break. The most common places are the spine, hip, and wrist. That is why some people first notice it after a hip fracture, a wrist fracture from a simple fall, or gradual height loss with a bent forward posture from tiny spinal fractures. Why does it happen? Age is a big reason. As we get older, bone breakdown starts to happen faster than bone rebuilding. In women, menopause is a major trigger because estrogen drops, and estrogen helps protect bone. In men, bone loss can also happen with age, low testosterone, smoking, heavy alcohol use, inactivity, low body weight, poor nutrition, long-term steroid use, and some medical conditions like thyroid disease, celiac disease, inflammatory bowel disease, rheumatoid arthritis, and diabetes. So if someone says, "I eat okay, why are my bones weak?" the answer is often that several small risks quietly add up over time. Now the part many people search for most, symptoms. Early on, there may be none. That is the frustrating part. Later, warning signs can include losing height, developing a stooped posture, back pain, or breaking a bone more easily than expected. But osteoporosis itself does not always announce itself clearly. That is why waiting for symptoms is a mistake. If you are older, postmenopausal, have a family history, have taken steroids for a long time, or have already had a low trauma fracture, getting checked matters. How do doctors confirm it? The most common test is a DEXA, sometimes called a DEXA scan, which is a bone density test. It is simple, quick, and usually painless. You lie still while the machine measures bone density, usually at the hip and spine. Doctors rely on it because it is one of the most trusted ways to diagnose osteoporosis and estimate fracture risk. Sometimes your clinician also looks at your fracture history, risk factors, and a fracture risk tool like Frax. And a question many people ask is, what is the difference between osteopenia and osteoporosis? Osteopenia means bone density is lower than normal, but not as severe. Osteoporosis is the more advanced stage, where fracture risk is higher. Treatment is where many people either get hope or get confused. The goal is not some magical overnight cure. The real goal is to slow bone loss, reduce fracture risk, improve strength and balance, and protect independence. For some people, treatment starts with nutrition, exercise, vitamin D, calcium, and fall prevention. For others, especially if fracture risk is high, medicines may be needed too. Doctors may use medications like bisphosphonates and, in selected cases, bone-building medicines. This is why copying supplement advice from random social media clips can waste time. Some people genuinely need prescription treatment, not just another bottle of pills at home. Let's talk about exercise, because this is where people either help their bones or accidentally scare themselves into doing nothing. The safe truth is this: appropriate exercise is one of the best things you can do. Research and major bone health organizations support weight-bearing exercise, muscle-strengthening exercise, and balance training. That means walking, stair climbing, resistance bands, weight training suited to your ability, sit-to-stand practice, and balance work. There is even a 2023 position statement on exercise guidelines for osteoporosis showing that multi-component exercise, especially resistance and impact work done appropriately, can help reduce important risk factors. But not every movement is smart for every person. If you already have spinal osteoporosis or compression fractures, deep forward bending, repeated twisting, and high-risk impact may be unsafe. This is why exercise for osteoporosis is useful, but right exercise for your body is even more important. Diet matters more than people think. Bone is living tissue, so it needs raw material. Calcium is important, vitamin D helps your body absorb calcium, and protein matters too because bone and muscle health are closely connected. Many people focus only on calcium and forget protein, strength training, and fall prevention. Better food choices include dairy if tolerated, fortified plant milks, yogurt, cheese, calcium-rich foods, and overall balanced meals with enough protein. Supplements can help fill gaps, but they should not replace a good plan. A very common mistake is taking random supplements without checking. whether the diet is already adequate or whether there are medical reasons bone loss is happening. There is one more thing that deserves real attention: preventing falls. A stronger bone is good, but avoiding the fall that breaks it is just as important. Poor balance, weak legs, bad footwear, dim lighting at home, loose rugs, and sedating medicines can all raise fracture risk. So sometimes the smartest osteoporosis plan is not only a scan and a tablet, it is stronger hips, better balance, safer movement, better lighting at home, and not ignoring dizziness or leg weakness. That is real prevention. And here is the most important takeaway. Osteoporosis is common, often silent, and very treatable in the sense that fracture risk can be reduced when you catch it early and act properly. If you have risk factors, height loss, a family history, menopause, long-term steroid use, or a fracture after a minor fall, do not wait for your body to give you a louder warning. Ask about a bone density test, start building bone-safe habits, and get a proper treatment plan if you need one. If you want, tell me in the comments whether you want the next one on the best osteoporosis exercises, the diet side, or the exercises people should avoid, and subscribe for more practical health videos like this.